Have you ever been made to feel crazy by our healthcare system? You know you got stuff going on. You're feeling real symptoms. Your chest is hurting. You got tingling in your hands, your feet, muscles are spasming, your stomach's giving you trouble, headaches, all kinds of stuff going on. But every time you go to get seen, whether it's in the ER with your primary care, everyone's telling you you're fine. They draw labs, the labs are normal, they do an EKG, you might have even gotten a GI consult and done some imaging or a scope, or maybe you've already spent hundreds or thousands of dollars with a functional medicine practitioner or some alternative med person, and still nothing's getting better. That sounds like you may be dealing with something known as PNEI dysfunction. What's going on, everybody? My name is Golfran Rivera. I am a board-certified physician assistant, and I practice a holistic approach to family medicine here at TrueCare DPC in beautiful Fayetteville, North Carolina. So here at TrueCare DPC, I treat all kinds of conditions, everything from the routine physical exam, enhancing wellness, to some of the more complex or confusing situations for patients where, like I said in the beginning, people have gone to see all types of specialists. They have unexplained symptoms, real physical changes in the body, and they just haven't been able to find answers. And so this video is for you if that sounds like you. So one of the reasons that people will run into these kinds of issues in the healthcare system, and you may have been made to feel crazy or like stuff is in your head, is partly because of the way that medicine here in the Western world views health and the body. First of all, the first thing you need to know is there is a difference between what's called a dysfunction and what is a disease. I like to explain to my patients this way. Dysfunction and disease, really, they live on the spectrum. Right? So a dysfunction is something where the way that things are happening in the body is not happening in a way that is conducive to well-being. Interestingly, a dysfunction doesn't actually mean right away that the parts aren't working, but rather they're working in a way that will ultimately lead to disease. A simple example, my favorite example, is type 2 diabetes. Before type 2 diabetes comes on, there's initially a resistance to insulin in the cells. Now, that resistance is actually a natural response in the body to the constant insulin spikes that are happening because of various factors that ultimately are causing our blood sugar to go up, right? So technically, that resistance to insulin is not a true dysfunction. It's a normal response to what's going on in the body, but it becomes dysfunctional. It doesn't promote well-being and ultimately can lead us to disease. Importantly, in our American healthcare system, when you go to see a practitioner and you go into the ER or your primary care, or even specialty care, what's really being looked for is disease. Okay, so we're not looking necessarily for signs of insulin resistance on your routine physical. What we're looking for is type 2 diabetes, type 1 diabetes. We're looking for frank disease, okay? And so the thing about that is that you might be having very real, very distressing symptoms that are physical in nature, but they don't fall into the category of disease. Okay, and so that what that means is that the labs that you're taking or the exams that you're receiving or the additional imaging or whatever, which are powered for disease, they're going to come back as normal because they're not looking for dysfunction. Now, of course, with everything, there's nuance, right? But you get my general drift. Now, why this is important, as I mentioned in the beginning, there is something called PNEI dysfunction. And the thing is that this is not old. It's been around since the 70s, and some work that kind of predates that in the 20s and 30s. But it hasn't, I don't know why, it hasn't really made it into mainstream education. We can speculate about that another time. But what I like to explain to people is PNEI dysfunction is really kind of like the Western world's way of describing what the East has known for a long time. And let me explain. So PNEI actually stands for Psycho-Neuro-Endocrine-Immunologic. Right? So it's a fancy scientific way of really saying mind-body connection, right? So if we break this down, because we like our big words in Western medicine, psych or psycho, that's your mindset, that's your belief systems. Neuro, that's your nervous system, everything from your brain out to your fingertips, and the nerves that cause vasoconstriction or constriction of your blood vessels or expansion of the blood vessels, everything in the nervous system, neuro. Endocrine is your hormones, all kinds of hormones and the glands that secrete them. And then immunologic, your immune system, right? Your primary, secondary immune system, the cells involved, the lymph system, all those different things. And so what this term is saying is how you think affects your nervous system, which can drive changes in your hormonal imbalance, which can then disrupt your immune system. And the thing is, it doesn't work in a straight line. It's not this, then this, then this, then this. Really, it's more like a circle. Because in fact, we know now that our immune system actually releases something called cytokines, which are proteins that make their way into the nervous system to drive what we call sickness behavior whenever you are sick. The way I think about it is like you might wake up knowing that you have work that you need to do, but because you're fighting an infection, viral infection, your immune systems are releasing these cytokines and essentially driving you to have a lack of motivation, a lack of desire, so that you will rest. And so that's an example of where the immune system is affecting the nervous system, which then in turn affects the psyche, right, and the mindset. So not a straight line. It goes in basically like the circle, this intertwined way of thinking about it. Now, usually people will have a misconception and think of Psycho-Neuro-Endocrine-Immunologic as another way of saying psychosomatic. Now, technically, if we look at the strict definitions of words, psychosomatic means mind-body. But unfortunately, in our cynical, just over science-driven perspective in this world, in the Western world, psychosomatic has become like a condescending way of saying it's all in your head. PNEI is not saying that at all. PNEI dysfunction is acknowledging that the way that we think, so let me write this here, dysfunction. It's acknowledging that the way that we think, okay, affects physically, causes changes in release of neuropeptides and other neurotransmitters in the brain, right? If we think a certain way often enough, our nervous system adapts by creating pathways through a process that we call neuroplasticity to make it easier to think that way more frequently. And if the thoughts that we are thinking require action, for example, anxious thoughts, fears of tomorrow, fears of deadlines, fears of danger, right? Then the nervous system is telling the endocrine system we have to get ready for action. And so we release a series of hormones to make that action possible. And neurosignaling chemicals like norepinephrine and epinephrine, and then your infamous cortisol, because those are meant to drive action, right? And then, of course, because we're constantly being told that we need to get ready for action, the immune system is going to respond either by being suppressed or by getting revved up. Now, how does this address these strange symptoms that you might be having? Well, again, if we remember, in the current healthcare system, we're looking for disease, right? Well, what this is saying is it is absolutely possible that your body will create physical changes and physical symptoms that are rooted primarily here, okay? In the relationship between your brain itself and your psychology. Most often, the people that experience these kinds of dysfunctions are currently or have been undergoing a significant amount of psychological distress, right? Physical assault, emotional assault, food scarcity, financial concerns, fears of losing your job, concerns about the family, bearing down weight on the nervous system, telling the nervous system that it needs to get excited and ready to go, driving the hormones in the body and disrupting the immune system. And what's wild is this can actually lead to a lot of sensitization in your immune system. And we're seeing more and more talk about histamine intolerance and mast cell activation syndrome. And there's a question of, is it that histamine intolerance, mast cell activation, are they their own things, or are they really extensions of this that what we're talking about? Again, in this country, we have a tendency to underappreciate the role that psychological distress plays on our physical body, and we separate it in the way that we understand it. But it's really impossible to separate truly the mindset from the brain, right? Like if we ruin sections of the brain, we actually make it almost impossible for us to experience certain things emotionally. And so when we appreciate that more and more, we can start to see that, yeah, like in fact, it is very possible that we are underappreciating all the different stressors going on in our lives and the physical toll that it's playing in our bodies. Now, I hope that explains things. I try to avoid going too far down the rabbit hole. It's a very involved topic. If you're watching this and it raises a bunch of questions, I love to answer questions. I also offer free consults. So please feel free to comment below. If this resonated with you or you think somebody might benefit from this, please share this with them. And thank you again so much for all your support. God bless you guys, and thank you so much for watching.